All right, let's jump right in. We're going to talk about something fascinating today, where modern medicine and deeply held traditions meet. Specifically, we're looking at donor human milk, which is an absolute lifesaver and a sacred principle that a lot of us in healthcare might not even know about: milk kinship.
So let's start with a number: 35 million. That's how many tiny, vulnerable newborns are born every single year. We're talking about preemies, babies with low birth weights. They're all at a super high risk for some really serious, life-threatening conditions. For these incredibly fragile infants, sometimes their own mother's milk isn't available right away. And that's where donor human milk, or DHM, comes in. It's not just nice to have, it's a medical necessity. The research is solid. For premature babies, donor milk can slash the risk of necrotizing enterocolitis, which is a truly awful intestinal infection, by almost half compared to formula. It is, no exaggeration, a lifesaver. Okay, so we have this amazing medical tool, but for millions of Muslim families all over the world, it brings up a really profound question. And that question revolves around a sacred principle called milk kinship. So to really get what the challenge is, we first have to understand the principle itself. What in the world is milk kinship? Well, in Islamic tradition, breastfeeding isn't just about nutrition. It actually creates a real, permanent, legally binding family relationship. When a baby receives milk from a woman, they become her child through kinship. It's a huge deal with all the family ties that come with it. And you know, this isn't just a cultural idea. It's written directly in the Quran. This verse right here lays out the biggest consequence of milk kinship. It creates a permanent prohibition on marriage between these new milk relatives, just as if they were related by blood.
So let's kind of map out this new family tree. The baby who gets the milk is now a milk child. That means they can't ever marry the woman who donated the milk, their milk mother, or her husband, the milk father. And, this is the big one, they also can't marry any of the donor's other kids who are now their milk siblings. It creates a whole new branch of the family.
But here's where it gets really interesting. The exact rules for how this kinship gets established, they're not set in stone. Different Islamic legal schools have different ideas. You know, how many feeds does it take? Some say just one sip is enough. Others say it has to be 5 full feedings. Does the baby have to nurse directly from the breast? Or does milk from a bottle or a feeding tube count? This variety of opinions is actually the key to finding a solution, as we're about to see. And this isn't just some abstract thing about marriage 20 years down the road. It has a real, immediate impact on daily life. Think about this. Muslim adoptive mothers will often try very hard to breastfeed their adopted kids. Why? To create milk kinship. It makes the child a mahram, a close family member. That means a dad can hug his adopted daughter, or an adopted son can be around his mom and sisters without strict modesty rules. It's what truly weaves the child into the fabric of the family.
So, you can probably see where this is going. How does this beautiful, sacred principle create a very real problem for modern human milk banks? Here it is, side by side. This is the core conflict. Standard milk banking, for efficiency and safety, often pools milk from lots of different donors, and anonymity is the default. But the Islamic requirement means you have to know who's related to who to prevent those forbidden marriages. The two systems seem to be on a collision course.
So, how on earth do you solve this? Well, the good news is medical and religious experts have worked together and come up with 2 main ways to make sure donor milk is safe, both medically and religiously.
The 2 solutions are actually pretty brilliant. The first path is to design the whole process so that it intentionally doesn't meet the religious rules for creating kinship in the first place. The second path is to assume kinship is created and then build a rock-solid system to document and track every single drop. Let's look at pathway 1, the avoidance route. The milk bank in Singapore is a perfect example. They work directly with their Islamic religious council. And here's what they do. They make sure babies get milk from lots of different anonymous donors, but only a tiny bit from any single one, so it never hits that 5 full feeds rule. Plus, they give the milk through a feeding tube, which gets around the direct suckling requirement for some scholars. By doing this, they sidestep the creation of kinship altogether. Pretty clever, right? Now, pathway 2 does the exact opposite. It basically says, okay, kinship is going to happen, so let's manage it. This way is all about documentation and traceability. No pooling milk from different donors, ever. Instead, they keep incredible records that link every bottle from a specific donor to the specific baby who received it. Now, I know what you're thinking.
That sounds incredibly complicated, but it's being done and done well right now. Let's look at how Pathway 2 actually works in the real world.
So, if you go to the United Kingdom, their milk banks operate under national guidelines that demand full traceability. They don't pool milk, and they have to keep all the records connecting donors to babies for at least 30 years. So, how does this work practically? Let's play it out. A baby gets donor milk, and a unique ID for that milk goes into their medical chart. Okay, fast forward 25 years. A marriage is on the table. The groom's mom has a thought. Hey, I donated milk at that same hospital back then. She can contact the milk bank, give her consent, and ask them to check her donation records against her potential daughter-in-law's records. The bank does a cross-check and gives a simple yes or no answer. That's it. The family gets the certainty they need, and the privacy of every other donor is completely protected. Okay, let's wrap this all up. As lactation professionals, or future ones, what are the absolute key things you need to remember to give culturally safe and really competent care?
First off, and this is the most important, just acknowledge and respect that milk kinship is a huge deal. It's a vital religious principle. Second, you can tell families with confidence that donor milk is permissible. It's halal because we have these smart solutions. Be ready to explain the two pathways. You either avoid creating kinship or you document it. This lets you reassure parents that systems are in place to handle their concerns. At the end of the day, your job is to help families make a choice that works for their baby's health and for their family's faith.
And that kind of leaves us with a bigger question to think about. This whole story of milk kinship and milk banking is just such a fantastic example. It proves that when we collaborate, when we show respect and get creative, we absolutely can weave deeply held cultural and religious values right into modern, life-saving medicine. It reminds us that safety is about so much more than just clinical outcomes.